So in this video clip, we're going to talk about a patient who's just come out of a cast for some common orthopedic condition, whether that be a posterior elbow dislocation or perhaps a fracture of the distal humerus or a fracture of the proximal radius or ulna. All of these common orthopedic conditions, generally speaking, your patient is going to be casted around 70 or 80 degrees of elbow flexion. And when a patient first comes to see us out of a cast, we need to start with, as per usual, toe region or early elastic region for both elbow flexion and extension. This manually correlates to our grade 1 and grade 2 mobilizations. So let's deal with elbow flexion first. Again, elbow stiff. Just came out of a cast. Have the patient support their involved elbow on their thigh, and perhaps a little additional pillow for some comfort. Okay? The elbow starts right at around the resting position, around 70 degrees of flexion. That's where your patient is going to be most comfortable. We take a supinated grip, support the thumb joint, and start with a small, quick grade 1 oscillation. Movement in the toe region of the stress-strain curve. Let's move that now into a grade 2, which is our fluid pumping mobilization. A little slower, about 2 to 3 cycles per second. But we're not at tissue resistance yet. We're not at the patient's end feel. Say for the sake of discussion, right after coming out of the cast, your patient is able to get to maybe 100 degrees. So let's get there. End feel, end feel, end feel. Now we're trying with cyclic loading to get beyond the elastic limit of the stress-strain curve and into the plastic region of the stress-strain curve with this 2 to 3 cycles per second. Now stopping right at the end feel, right at the point of tissue resistance, we now do a grade 4. Again, cyclic loading at the point of tissue resistance. And these 4 grades are generally something that you can give to a patient immediately after they've come out of a cast.